Changing your lifestyle could be a big step towards diabetes prevention, and it's never too late to start. Tammy Osborne from St. Mary's Medical Center joins us now with some guidance. Thank you for being here, number one. Now, I have to admit, I don't know a lot about diabetes beyond the fact that I know it's about blood sugar and insulin is involved somehow. Can you just kind of give me the basic rundown of what I should know about diabetes and what I should be looking for?
Well, diabetes is very prevalent. There are over 30 million adults that are diagnosed with diabetes. There are over 80 million adults that are pre-diabetic, and 9 out of 10 of those adults don't even know that they're pre-diabetic. And diabetes carries a lot of risk factors. So with diabetes and even elevated blood sugars, you're at increased risk for cardiovascular disease, meaning heart attacks, congestive heart failure, stroke, kidney disease, blindness, vision changes, peripheral vascular disease that can affect whether or not you lose a limb. And so it's really important to be aware of that. It's not just about insulin. Many diabetics do not get treated with insulin. We can actually treat prediabetes with lifestyle changes, meaning that they change their diet and have a healthy diet and have a healthy amount of exercise.
So what then should we be looking for, as evidence of pre-diabetes, or knowing that we're kind of going on down the road that can lead to a diabetic, what's the word, diabetic, not prescription, but when you, a diagnosis,
Diagnosis. So there are risk factors for diabetes. One, having a body mass index, meaning a BMI over 25, which means you're overweight, and that's a calculation based on your height and weight. There are things like a sedentary lifestyle. And then there are risk factors that you can't change, meaning a family history of type 1 or type 2 diabetes. Certain ethnic groups, African American, Native American, Hispanics, Pacific Islanders, and Asian Americans are slightly increased risk. But we have a lot of adults that don't realize that they have symptoms of diabetes because they're tired, or they have increased urination, or they're getting up at night to urinate. They feel thirstier than they did before. They're getting numbness or tingling. And a lot of times they'll write those symptoms off to other things, like the normal aging process. And when we see them in the office and we screen them, then we find that they have diabetes or they have prediabetes.
So it's definitely worth, when you have those symptoms, to see your doctor about it and definitely ask those questions. Don't brush it off as something else, because it could be something much more serious.
Most definitely. And I think that getting an annual screening for your A1C, so if you're over the age of 45, you have that BMI of over 25, getting a normal blood draw in an office setting where we check a number called a hemoglobin A1C, and that gives us a percentage, and there's a level 5.7 to 6.4 tells us that you're pre-diabetic, and a percentage of 6.5 or greater means that you're a diabetic. And so then we can talk about the treatment options and what we do about that.
And where should I go if I'm looking to find more information? Like maybe I'm sitting at home right now watching, and I'm like, well, my leg has been tingling, and where should I do next?
So I would contact your primary care provider, and I would get seen and have those blood draws done. But there's a lot of information on lifestyle changes on the CDC, on the American Diabetes Association website as well.
All right. Well, Tammy, we do appreciate you being here today. St. Mary's Medical Center invites you to their Lifestyle Changes to Prevent Diabetes event on Tuesday, May 21st. It's from 6 to 7:30 at night at St. Mary's Medical Center in Blue Springs. For more information, call 816-228-5900 or go online to stmaryskc.com.